President and CEO for HR Service. We're a compliance and professional HR support organization. And on behalf of Nielsen Benefits Group, we welcome you to our training webinar today. We're going to talk about some of the changes that have gone on in employer health care reform. If you're like most of us, we're all a little bit tired of hearing about health care reform. They start something and then they pull something back, and it's a little bit challenging. We're going to go through, let's go through some of just the key changes that have occurred this year and talk about some of the things that you need to do now to prepare for now as well as 2015. So if you have any questions as we go, please feel free to send me over a message. So some of the changes that have taken place, as most of you are aware, the individual mandate is in place now. So everyone is required to have a medical insurance plan. And if they don't join the plan, then there are penalties. They start out as low as $95 per person, $285 per family, 1% of income. They raised another 1% next year on up to 2.5% by 2016. There's now guaranteed issue. You can't deny coverage. Insurance plans must accept everyone. There's no experience rating or pre-existing conditions. The only thing they can rate up on is they can still base on age, although that's been narrowed now on a 3-to-1 ratio. They can still rate up on smoking and on location. We also have the introduction of the health insurance exchanges. So all across the country, there's various exchanges. There's federal exchanges, state exchanges. In the state of Utah, we have the what's called the Avenue H. There, they handle the Utah exchanges for businesses. And as you're aware, there's a number of different plan level options there: bronze, silver, gold, and platinum that someone can select for. Most of the folks on this discussion here today are larger employers of 50 plus, so this pretty much doesn't apply to you. So we'll skip over this relatively quickly. We've had the expansion of Medicaid. Expands Medicaid from low-income Americans up to 133% of the federal poverty level. So that's $14,856 for individuals, or $30,657 for family of 4. We also have waiting periods that have been capped now at 90 days. So all new hires need to be able to join a medical plan within 90 days. And most of you already have that in place. So all of these things should be in place now. There's individual tax credits or subsidies that's available for the lower income folks in that 100 to 400 poverty levels, and if they're not eligible for an affordable plan. There's also essential health benefit requirements that are in place. Deductible caps can't exceed $2,000 for individual or $4,000 for family. No annual limits. Now, one of the major things that's been delayed is, of course, this employer mandate, where employers were required to offer coverage. Those who had 50 or more employees, they were required to offer coverage. The coverage had to cover essential benefits and had to be affordable. We'll talk a little bit more about this as we talk about some things to prepare for 2015. Wellness plans. Those of you who offer wellness plan incentives, used to be 20%. Now you can have up to 30% discounts tied into your wellness plan for participation or for results. There's some very specific requirements you have to follow inside of that. We won't go into those today, but if you have questions or would like assistance, please feel free to reach out to us. It can be up to a 50% discount for smoking control for those programs to try to reduce smoking. All right, so let's talk. I'm going to shift now. Those are some of the main new things. I didn't go through everything that's already in place. But I wanted to spend our time focusing on what do I need to worry about now. So, of course, if you're borderlining being a large employer or not, you have to look at that and decide, am I a large employer? Because we need to start making plans for 2015 when this comes into play. At this point, our understanding is that it will be 1/1/2015. There's a chance they may have some sort of a phase-in to where it may not be effective until your renewal date. We haven't received final assurance and guidance on that yet. So at this point, I would plan for 1/1/15 for the employer mandate. If you're a large group and you're a large employer, or if you're borderline, you have to take into consideration all patrolled groups that's under your direction as well in that count. You also have to look back at the calculation is as you take your full-time employees, you add in your part-time and seasonal employees, and add that up. And if you have 50 or more full-time equivalents, then you are a large employer. In 2015, the employer mandate, or the sometimes called pay or play, would come into effect for you. Now, there is a allowable in this calculation. You can exclude if what puts you over the 50 mark were seasonal employees. You can exclude 4 months of the seasonal employees in that calculation. And so, again, most of the groups that my understanding is participating in this event today, that would not be an issue for that you're already a large employer. But if you're close, there's some special calculations there, and we can assist you with that. All right, so here's a big question for everyone is do I continue to offer medical insurance? Can employees qualify for subsidies? Is it better off, am I better off to, now if you're a large employer, then you're facing those penalties of the $2,000 if someone goes and gets a subsidy and you're not offering coverage, or if you're not offering minimum essential value or affordable coverage, then there's the $3,000 penalty. So there's penalties that can come into play. We all have to kind of step back and evaluate, what's my competition doing? Can I attract and retain the right people? Do I fully understand the tax benefits that I get from offering benefits, the additional savings on Social Security and the other tax benefits that come into play? What are the costs if I don't offer coverage? So we all have to be asking ourselves these kinds of questions as well as we evaluate things moving forward. One of the most critical things that you're going to need to focus on now is which employees are covered, because the decisions that you make now and your handling of your staff, the hours worked, will drive who will be covered in 2015. And a lot of you, that applies right now, because a lot of the insurance companies, a lot of you have already made changes where you're defining full-time as 30 hours or more, working an average of 30 hours or more. They do allow a little bit of marginal error in that 95% margin of error calculation. Then you have to be asking yourself, too, who do I want covered? Because you may have some individuals who may be eligible for coverage or you didn't plan for it. All of a sudden you're impacted and your overhead costs are much higher than you anticipated because you didn't realize, oops, now I'm going to have to add all of these people into the plan. We need to start making plans right now to be prepared. One of the most important questions that you have to address is what's referred to as a measurement period. What measurement period will you use? The law allows you to choose measurement periods from 3 to 12 months. What a measurement period is, the measurement period allows you to, if this is the time period that you measure the work hours of all employees, and those who work an average of 30 hours or more over that measurement time period, they then are eligible for coverage. So this is why this is a critical decision that you make. You can choose anywhere from 3 to 12 months as the measurement period to decide who's covered. There's also what's referred to as a stability period. In the stability period, this is the time period that once you've determined who's eligible for coverage, this is the time that they're now guaranteed that they can be offered coverage, unless something like termination of employment takes place. So the stability period is equal to the measurement period that you've selected. It can't be less than 6 months. So if you're using a measurement period of 3 months and you've decided, okay, they're eligible based on these 3 months, they have to be covered on the plan at least 6 months. And you'll see it. We believe that most employers will probably use the 12-month measurement period just for the sake of administration and record keeping. And I'll show you an example of that here in just a moment. But if you're able to go by your plan year and use your months of calculation and everything, it will be much easier for you using a 12-month, but you certainly have the rights within 3 to 12 of making other choices. But I'll show you an example of that in just a moment. Now, obviously, if you have a stable workforce and the work hours are pretty set, this is going to be an easy exercise for you. The challenge will be those who have variable employees, where their work hours and their schedules fluctuate based on, maybe they have times where they're working overtime and times where there's no work, and those you're going to have to, it's going to be challenged tracking their hours and deciding who's eligible for coverage or not. There's also what's referred to as an administrative period. So an administrative period, this is the time they allow, you can schedule this at the end of your measurement period. It gives you a little bit of time to process, do your calculation, offer coverage, get people set up. That can be up to 90 days. In the example I'm going to show you now, I'll use an example of 60 days. I believe an administrative period of 60 days is, in most cases, it's plenty of time to handle those types of calculations and such. Let me show you an example. Okay, so here's an example of a measurement period of someone who's using a calendar year. I'm sorry, they have a calendar year plan. So what they do, they have a measurement period. Their measurement period is for a full 12 months. So they go from 11/1 to 11/1/13 to 10/30/14. This will be the time period that they'll look at their work hours for their staff. And then they'll have an administrative period. I mentioned of 60 days in this example. So in this example here, there's 60 days where they'll do their calculations, figure out who's ready, and then they'll be ready to implement their plan 1/1/15 to 12/31/15, which will then be their stability period. So again, just to reemphasize, they do the calculation as who's eligible over a 12-month period in this example. In this example, they're going clear back into 11/1/13 to 10/30/14. And they have the 2-month administrative period and then the stability period. So now if they do the same model again in 2016, this is what it would look like. Same thing there, they do 11/1/14 to 10/30/15, and then they'd have their 60-day administrative period and then their stability period. All right, so dealing with all of this, how do we handle new employees as it relates to this measurement period and eligibility, and when do I start them and such? Well, if you expect that someone's going to work full-time, and it's pretty obvious that it's a full-time position, then you start them, in your normal, after your normal waiting period. It can't be longer than 90 days. So you just start them right up. If someone, however, is a variable hour employee, meaning that you can't determine if they meet that 30-hour plus requirement full-time, then you would follow into your measurement period. Now, the measurement period can't exceed 13 months. So you have to get them have them actually start on a plan no later than 13 months. And it has to be a legitimate situation. You can't, it has to be obvious that there was a variable hour thing, and at whatever point, along those lines, that, if it's obvious, then you should just go ahead and start them on a plan. Now, a little bit more about this measurement period. You can determine when your measurement period starts and ends. You have to be uniform, has to be consistent. You can do different categories. You could have bargained employees. You could have a different measurement period for salaried and hourly. You could have a different measurement period for different locations or different entities. Just bearing in mind, the more variability that you have inside of that, the more measurement periods, the more complicated you've made it, and the more tracking and such that you're going to have to do. Okay, so, and by the way, if you have any questions or anything, please feel free to kick those over. I'll likely address questions towards the end if that's okay. So, but if you have any questions at all, please feel free to send over your questions. All right, so one of the things that's important throughout this process now, because we've had this measurement period, we have to be able to define and demonstrate. If we're ever audited on all of this from the IRS, we have to be able to demonstrate that we have handled the full-time equivalent correctly, that we've handled the eligibility correctly, and in order to do that, we're going to need to be able to show our calculations and how we determine those. So we need to set up processes and systems in place now to be able to track those work hours. You should have policies and practices in place for your part-time employees to make sure that you don't have someone that's working more hours than you want them to, that's all of a sudden going to make them eligible for benefit. And by the way, one of the things I want to emphasize on that, back to that measurement period discussion again, once somebody's in their stability period, even if they change their work hours to where they're just part-time again, they're still eligible for benefits through that full stability period. If you haven't done so already, you'll want to change your full-time definitions in all places, such as your handbooks. Also need to be changed in your summary plan descriptions, which, by the way, most of you probably are aware, you need to have a summary plan description for each of your health and welfare benefit plans, your medical, dental, life, and disability, and any other health and welfare benefit plans, and communicate any of these changes and how things will be handled. So these are some of the main things that you need to be looking at right now, so that we're effectively guiding and preparing for who we want covered and such. Again, a lot of you are doing this already still. So if we look at some of the workforce planning options that you may consider, you add in more part-timers, you add in more seasonal employees, more temporary, do you outsource, do you have more independent contractors? And all of these are certainly considerations as you're planning out your workforce, your expenses, and who's going to be covered on a medical plan. Bearing in mind, if you add in more part-timers and temporaries and seasonal employees, it takes more scheduling. There's more training. There's more supervision that comes into play, and potential employment risk. Because you've got all these other individuals that may violate your policies and procedures, or that may sue you for something. So just, again, something to keep in mind. There's also very strict independent contractor rules. We can't just go out and say, let's make everybody an independent contractor. They have to be able to follow very specific IRS guidelines. If you misclassify, there's severe penalties and costs associated with that. So you want to make sure that you're handling those things correctly. But nonetheless, it's worth evaluating and looking at as you're planning out your workforce this year and who's covered. Are there some of these kinds of plans that come into play here that make a lot of sense for you? Okay. So now as we move into plans for 2015 and some of the things, it's a good idea to start planning out how your cost sharing is. Of course, a plan has to be what's referred to as affordable. So if a plan is affordable, then the lowest cost for the individual coverage cannot exceed 9.5% of the W-2 wages, or 9.5% of the federal poverty level. So there's some calculations that you need to do. You need to compare your lowest cost for individual coverage to that 9.5% rules, and make sure that there's any changes or adjustments that need to take place therein. Set employee contributions to 9.5% or less of the lowest paid employee based on those W-2 wages. And so make sure that your plans are affordable. It's probably a good idea to start doing that kind of thing this year even, so that you're getting your premiums and pricing in place and ready to go. Adjust your premiums as needed, at least by open enrollment. I mean, obviously you can't make mid-year changes in your pricing, so if your plan's already in place, you're in effect and you won't make any of these kinds of adjustments until your next renewal. But if you haven't had your renewal yet, it's something to consider doing right now. Coverage has to meet minimum value requirements as well. So you must provide a minimum value covering 60% or more of the total allowable cost. There's special calculators that can help you evaluate this. Also, Steve Nielsen and Lloyd Coleman of Nielsen Benefits can assist you and guide you in this process. As a general rule, most insurance plans are taking care of this. It's something that pretty much all of them, in my opinion, is making sure that the minimum values are there and that they're handling that and taking care of that on your behalf. But nonetheless, it is a requirement. If you're not meeting that minimum value, you could run into some challenge. But it is, insurance companies are really watching that and taking care of that for you. All right, well, back to our discussion on pay or play. So again, this comes into effect in 2015 with the where anyone with 50 or more employees will be required to participate in the plan. And all of the folks on this call here are already doing that, so it's kind of really not a big deal. So just making sure the things that we've talked about already. Who do you want covered? Make sure that you're changing your definition of full-time employees. Make sure that your premiums are affordable at 9.5% of the W-2 wages of the individual. Make sure that your coverage meets minimum essential value. And again, a lot of those things are already kind of in place. So I guess what I'm saying in summary, there's not a whole lot of changes and things that you need to take care of right now. Other than making sure to define your measurement period, get that process in place, get a tracking process in place where you're tracking work hours so that you're able to defend those definitions of who's eligible and who's not. And that's sometimes a challenge, especially when we're talking about salaried individuals. Now, salaried individuals are, normally working 40+ hours, and you're providing coverage for them. Great. If you're excluding anyone, if you have any part-time salaried individuals, those are ones you're going to need to have a process in place where you're tracking their work hours as well. All right, so we've talked a little bit about, does it make sense to offer coverage? There's some other things that you want to discuss with your broker, Nielsen Benefits Group, Steve or Lloyd. Look at the different options to how do you control costs now that you're offering coverage? Self-funding or fully funding. You do offer dual plans, perhaps one with a minimum essential and one with a higher benefit, higher benefit option. You look at the HSA options. Do you fund premiums of individuals at 80 to 100% to avoid the minimum cost, so that you make sure you're meeting that requirement? A lot of things to consider, and these guys are great at assisting you and walking you through that process. All right, the last thing I'd like to discuss today is the DOMA, Defense of Marriage Act. Now, I bring this up, and this is totally outside of our discussion on affordable health care, but there's a few things that I wanted to remind you of in here as well. So as you have read in the newspaper and heard on the news, Section 3 was found unconstitutional in the Defense of Marriage Act, which prevented the federal government from acknowledging same-sex marriages. With these changes, they do not force the same-sex marriages on all states. They're letting them decide that on their own. The state of Utah waffled back and forth. At one point, they said that yes, we're going to acknowledge that as well, and now it's being challenged, and now it's on hold. So stay tuned to that. We'll keep you informed of how that takes place, where that goes. You'll hear more on that, I'm sure. Some special considerations that do come into play for you as employers. How do you define domestic partners or handle same-sex marriages for your benefits right now? And you want to work closely with your agent, the insurance company, make sure you've got that right definition that fits for the way you want to handle that. Most of the insurance companies, my understanding is they're allowing you to guide that definition inside of there at this point. But you have to look at the places where you have coverage, because some states are requiring that. So if you have employees, say, in the state of California, or any of the other 13 states that offer this, you'll need to make sure that your definition is aligned to meet those requirements. You also now will have to, because the federal government acknowledges same-sex marriages, any of the federal government programs, you're going to have to follow those. So with COBRA, so if someone is out on COBRA or family medical leave, in both instances, you'll have to follow and offer those family medical leave to same-sex partners, for example. Same with your pension benefits and 401ks and the beneficiaries inside of those. You'll have to go in and allow same-sex partners to be able to list them as beneficiaries and stuff. So a couple of things from a benefit standpoint as it relates to DOMA. All right. Lastly, just wanted to emphasize there's a little bit there's some concern going on out there in the market right now. The Department of Labor has hired more auditors. We hear different numbers. I've heard anything from as many as 18,000. I think that's I don't believe that number, but anyway, they've hired a lot more auditors, and they're increasing the number of audits. questionable, the motive. Are they trying to force everyone into compliance with all the healthcare reforms and the various ERISA laws and requirements? Or are they looking for more revenue to fund some of this? Could be all of the above. And nonetheless, they are taking place, and so there's some things that you need to make sure that you're ready. Now, there are fines out of there. The Department of Labor estimates that 3 out of 4 plans that they've audited, they've found ERISA violations. And a lot of them have been resulting in fines. Can be as much as $110 a day for violations and such. So it can be a pretty hefty fine. So it's worth looking at your plans, making sure you have everything in place. They claim that they're going to audit everyone by 2018. And there's no, even smaller companies are at risk. We have a 15-person client who received an audit, an ERISA audit that they're going through right now that they were notified last week. And anyway, they'd like to see copies of that audit. I'd be happy to share that with you. But some of the things they're looking for, they require a summary plan description for all plans. I mentioned earlier, medical, dental, life, disability, HRA, cafeteria plan, all of those, any health and welfare benefit plan has to have a summary plan description. Summary plan description is more than just what you receive from the insurance company. Meet the definition, the requirement. There's other things, other components that need to be included in that. So that summary of benefits you get, or the summary of benefits and coverage, does not fully meet the requirements. And they're also looking to make sure if you're providing all of the various notices. So there's women's health and cancers, newborns, HIPAA, Medicare Part D, CHIP, COBRA, initial and qualifying event notices, all these different notice requirements. They're looking to make sure that you're providing those, and 5500, that you're doing those and filing those appropriately. If you have 100 or more participants on a plan, you have to file a Form 5500. If you you have to do that for each of your health and welfare benefit plans that have 100 or more. A couple of other things to watch out for and to be aware of, and Steve Nelson and Lloyd Coleman and their team at Nielsen Benefits can help you, help guide you through all this process. By the way, we at HR Service, we do help with compliance, so we can help you with your notices, we can help you with your wrap services, or any of your other HR needs. And because you work with Nielsen Benefits, you receive 5% off of any of our services. So I open that up. If there are any questions at all, please feel free to send those over now or to contact me. My phone number is 801-685-8400. I'm at extension 6. My email is just ken@hrserviceinc.com. You can visit us online at hrserviceinc.com as well. So it looks like at this point I don't see any questions that have come over. So we will go ahead and wrap up our discussion here today on our healthcare reform. And we are recording this, so we'll make this available to anyone that would like any of the copies of the slides or the other information, or if you have others at your office you'd like to see this. Thank you, everyone. I very, very much appreciate it, and thanks to Nielsen Benefits Group for sponsoring this, and to each of you, and best of luck with your compliance efforts.